Hello, Dr. Touchinsky here from PEAK Integrative Medicine, and I'm recording this video today because I see a lot of people out there that are paying way too much for their health insurance needs. A lot of employers are paying way too much for their health insurance needs for their employees, and I just want to let people know there's a viable alternative out there. And if you are sick of paying high insurance premiums along with high deductibles and copays, and you just got notice that they're going up yet again, this talk is for you. I'm going to move pretty quickly through a lot of slides, but don't worry, if you have any questions, there's going to be a link at the end to the company that I use personally, or you can reach out directly to me and we can discuss it further. I'm keeping this presentation fairly agnostic. I know there are several good health share options out there. I'll share my own experience and the experience of patients and family members who use the company that I use, but whichever one you look at, do your homework and make sure it's the right fit for you. Here's the game plan for today. We want to cover this in about 15-20 minutes. We'll talk about why insurance has become so expensive and what's actually behind those rising premiums. Then we'll look at how health share plans work, why they're usually far more affordable, and I'll show you some real-world examples of what people are saving. We'll cover who these plans make sense for, who they probably don't, how we use them inside our own practice, and finally, I'll address the most common concerns that I hear. So why does this matter to me? For me, it's not just about the money. It's about integrity. It's about ethics. The current insurance system often takes advantage of both patients and providers. They charge you more and more. They deny care. And for us providers, they're paying us less than ever. In fact, when I dropped out of insurance over 4 years ago now, I was getting an average of 50% less per visit than I did when I started in 2005. Health share plans also align with our values. They're very transparent. I believe they're more fair than standard insurance plans, and they are community-minded. And just to be totally transparent, if someone signs up through the company that I use personally, our clinic receives a small stipend. It's literally like $5 or $10 a month per member. And that's not why I'm sharing this, though. I'm sharing it because this approach truly changes how healthcare feels for both patients and providers. And again, I think it's just a better option. Foremost. So we've seen an over 300% increase in premiums over the past decade. And you can see here on this chart, you can see how premiums have exploded versus regular inflation. It's one of the fastest rising household expenses, and for many families, it's now more than their mortgage payments. And for employers, it's a very significant cost. So employers that want to offer their employees coverage and benefits, it's getting to the point where all that money is just being extracted from the business. Employers switching to a health share plan will have more money available to give raises, to cover their own expenses, and even offer some other benefits and perks that they can't offer now because they're spending so much on just health insurance premiums alone. And if you're an employer out there and you want to talk more, I've been working with several local employers here in Schuylkill County, and we've come up with some creative ways to make the plans work for them. I know it's kind of a weird thing, and if they don't have the benefit of a presentation like this, I'm more than happy to come to your place of employment and explain it more. And then there's other ways we can incentivize people choosing this plan over traditional plans, which will save you a ton of money. So they're increasing premiums, and meanwhile, the insurance companies they're doing great. They're not hurting. So they're not raising it because they have to just barely cover expenses. Their revenues have climbed over 300%, just like premiums have during the same time period. So yes, costs are rising overall, healthcare expenses, but not because your doctors are suddenly getting paid more or charging more or getting more. It's because the system funnels your money towards corporate profits, not better care. Most of these insurance companies, these large insurers, are publicly traded companies, and they got to worry about their stockholders. And that's really the crux of the issue here. The real issue is profits have become the priority. And every time you need care, you're waiting on an approval. A faceless adjuster decides if your treatment is quote unquote medically necessary, even though your doctor wouldn't order stuff if it wasn't necessary, but you have some insurance company middleman, so to speak, that's deciding what health care you should be getting. And that's not health care, that's bureaucracy. It ties the hands of good doctors and frustrates patients who just want help and need help. So enter health share plans. They've been around for at least, it's before Obamacare passed, so it's at least 15 years now. They've been around. I think they've been around for more like 20, 25 years. The company that I use personally, They've been around for over 10 years, and they're not insurance, so it's not traditional insurance. And if you talk to an insurance adjuster and ask them what they think, they'll say like, oh, well, it's not health insurance and they don't have to guarantee payment. I would argue that insurance companies don't either, because they deny everything and make it really hard to get the care you need. My personal experience with these health share plans is they've been completely transparent. They have medical guidelines that they follow, and I haven't ran into any problems yet, unless it was like a pre-existing condition that they just didn't disclose. They offer much lower monthly costs, but you have the freedom to choose any provider. There's no networks. You can go to whomever you want. You get the bills, you get the notes, you submit it, you get it reimbursed. And that's a level of transparency and flexibility that you just don't get with regular insurance plans. It's healthcare that puts people back into control, in my opinion. So how does it work? So what does it look like day to day? When you go to your doctor, you simply say, hey, I don't have insurance. I'll pay today at the time of service. And for that reason, you usually get a discount too. And you'll find that instead of paying the insurance inflated rates, you're going to pay a much lower cost, which will often even save money over what you would normally pay, because when they bill insurance, they bill a much higher rate. Yeah, you get the in-network deduction, but the cash discount, the direct discount fees are much, much lower, and sometimes 80% lower than what they would bill and get through your insurance. And if you have a high deductible, you're paying that. So you go get the service, you pay for it, you submit it through an online portal, and then they process it. And if it's an eligible expense, you'll get reimbursed, often within a few business days. And if it's a big procedure, you can usually get pre-approval or even prepayment arranged beforehand. It's really straightforward, and it's quick and easy to do. So who's this for? Who's it not for? So health share plans tend to work best for people who are generally healthy, families or individuals who want protection for the big unexpected expenses like accidents, hospital stays, and surgeries. They're great for folks who are frustrated with the traditional insurance and want lower monthly costs with more freedom to choose the providers they want. But they're not for everyone. If you have frequent, high-cost medical needs, rely on government subsidies, like if you're going through Penny, you're going through any of the exchanges if you're out of state and not in Pennsylvania, or your employer covers most of your insurance, then sticking with your insurance plan probably makes the most sense for you. But I would still look into it, because you can really save a substantial amount if you're paying all or part of your premiums. It's about matching the right tool to your situation. So again, as you're going through this, you're going to want to make sure that you do your due diligence. And if you have a pre-existing condition, some are okay, like hypertension, diabetes, things like that are fairly common. They will still pay for stuff like that. They will still accept you. And even if you did have a major pre-existing issue, I would still, again, because you're saving so much potentially, I would call the companies that you decide to go with or decide to look into, explain your situation, and ask them how they would handle if you needed something for that. One example is, like we see people with Crohn's disease or ulcerative colitis, so an autoimmune condition, but it's well managed and they haven't seen a GI specialist in over a year. They haven't had any procedures done. So in this context, for most of these plans, it won't be considered a pre-existing condition. So there again, even if you have a pre-existing condition, I would talk to the company, explain your situation, and see how they would handle that, because you have a lot to save. So here's some side-by-side comparisons. I'm not going to read through the entire slide, but in general, health insurance offers broad coverage, but it's very expensive and it's full of fine print, and there's many layers of approvals that are required. There's many hoops to jump through for yourself and your doctors, whereas a health share plan focus on the major big stuff, the emergencies, the surgeries, hospitalizations, and they have some small exclusions like insulin, for instance. So if you're an insulin-dependent diabetic and you would have to pay a lot out of pocket for that, then a plan like this wouldn't be for you. But because of those few exclusions and because they only cover the major stuff, this is why it can cost 30 to 60% less in your annual premiums. You aren't stuck in a network. You get to choose your own doctors, go over wherever you want. Again, you're basically a cash pay patient and you're direct pay. So when you go see them, you're not in an insurance plan, and then they can just bill you directly, which, like I said earlier, can save you a ton of money just by doing that. And also it can prevent you from having to go through a lot of those hoops you got to jump through. So a common occurrence that we see, that I see as a chiropractor, is if they have a suspected disc herniation, they got a pinched nerve in their low back, it's radiating down their legs. it's kind of obvious it's a disc herniation. So to get any type of procedures done, like an injection or even ultimately surgery if they need that, you can't just get an MRI, even though you want one. You have to go through 6 weeks of like PT or chiropractic care 2-3 times a week. So you're paying all those copays, investing all that time. Whereas in this case, you could just say to your doctor, say, hey, I'm paying for it out of pocket. So if you think I need it, order it. And then you can just go and pay directly. And then if you go over the amount of that initial on-shared amount, which we'll talk about in a moment, you get reimbursed for anything over that amount. And so that way you can just jump right and get the procedures done that you need, that your doctors think you need, and you don't have to jump through those hoops. So I mentioned initial on-shared amount. So that's one major difference between a health share plan and an insurance plan. So in the health insurance world, you have something called a deductible. So that's the amount you have to pay up until the insurance kicks in. And then after that, there's usually a copay or co-insurance that you have to pay in it. So it's usually like 20% of what that fee would be. But instead of a yearly deductible for a health share plan, they use something called an initial on-shareable amount, or IUA. So think about this as your out-of-pocket max per incident, per health issue. Once you meet that amount, then the rest is eligible, and costs are shared at 100%. So an example would be if you go to the ER and you have stomach pain, they find out that it's an appendix that needs to come out, and you have surgery. Let's say that whole hospital experience, that whole stay, including surgery, cost $8,000, and you have a $1,000 initial on-shared amount. You pay the $1,000, and then you'll get reimbursed for the rest through the health share company. So very simple, very straightforward, and then they usually cover 100% of shareable expenses after that initial on-shared amount. So let me give you some real numbers. This is personal experience. When I was on traditional insurance, the monthly premiums were about $1,250 a month, and this is going back probably 4 to 5 years ago. So that's $15,000 a year. My deductible for that plan was $16,000. So that means anything under $16,000 I was paying for anyway. Now with my health share plan, when I switched over, I was only paying $450 a month, and that's with $1,000 IUA. So that's just in premiums, monthly payments alone. That's about $9,600 in annual savings. And then when something happens, I'm not paying up to $16,000 of the expenses per year. I'm only paying that first $1,000 for a particular problem. And every expense that I've submitted has been reimbursed without hassle. So here's a case of a patient. We had 2 patients actually, 2 women who needed thyroid ultrasounds because we found a mass in their thyroid gland. One patient, Blue Cross Blue Shield, thyroid ultrasound, across the street from our office. They had a deductible, high deductible, so it was billed out at about $2,200. The in-network discount got them down to $1,200. So that sounds like it's great savings. They saved $1,000, right? Wrong. Another patient using a health share plan told the provider they'd pay cash up front, and their total cost out of pocket was $300. It was the same exact test, same facility, $900 difference. So not only is the health share person paying less per month, they're saving about $500-$600 a month on their premiums, but they also save $900 on this particular procedure. Another one is routine labs. So a couple patients, we went for routine labs for their annual physicals. It billed out at about $800. The in-network discounts got them down to $600. So they saved $200, right? No, wrong again. The health share member paying directly paid about $60 for those same tests. So 10 times less. Employer savings. So I talked about employers earlier. We have a small company that was working with us, or that is working with us, and they had 15 employees only. They switched from traditional plan to a health share plan, plus what we do here at our office. Their annual costs dropped for healthcare expenses, including paying for our practice. Went from $216,000 a year to about $86,000. So for that small company, just 15 employees, $130,000 savings in that year, while still giving their employees great access to care. And in fact, they're even able to give a couple $1,000s to each of those employees on health-related expenses. So that means they can go and get a massage once a month, they can get chiropractic care, they can buy comfy boots, they can get a mattress, a new mattress, so they sleep better at night. So now they're actually receiving a healthcare benefit. And even if every one of those employees max out the $2,000 that they're giving them for that stuff, they're still going to save a ton of money, because that's only 2,000 times 15 is $30,000. So they're saving $130,000. So they're still saving 6 figures. And I know people think, is it too good to be true? What's going on here? Fair concern, because I thought for a while it was too good to be true as well. So what are they not covering? What are they doing? Is it risky? And one of the knocks against these health share plans was that what if everyone gets sick all at once and they run out of money? Well, we had that test. We had that pressure test during COVID when you had tons of people going for health-related issues, hospitalizations, in the ICU, on ventilators. So lots of expensive care was being done at that time, but they were just fine. And in fact, they didn't raise prices at all through that entire period. They only raise prices now. So this is going on like 5 years later. They increased their monthly premiums by about $50. And that's over like 5 years. That's not $50 or 5 or 20 or 30% like some of you are seeing year over year. That was just a one-time raise since I started using them. And I said 3 years ago. It's probably more like 5 years ago that I started with them. And they always send like newsletters, at least the one I use. They say, okay, they collected this much in premiums. They paid out this much in shareable expenses. And what they collect is always a little bit more. So they build up that fund for everyone to use. So they're very healthy, they're very stable, and they get the job done. And I have the slide here because this is why we were first made aware of them, because as we were starting this practice, we're like, well, what could we offer, or what could be beneficial for our members, because they're paying us out of pocket for their healthcare expenses here at our office, but some people will try to use that as their only health coverage. But the big bad ugly things can happen. The cancers, the heart attacks, major surgeries. So you still need to be covered on the high end of things for those types of catastrophic issues. So that's where we found the health share plan. So in our practice, we cover the quote unquote everyday stuff. So your chiropractic care, your sick visits, your annual physicals, and then if something, God forbid, happens that's major, you're covered by the health share plan. So if you're tired of paying more and getting less, maybe it's time to try something different. You can scan the QR code on the screen. It'll take you right to the company I use personally for my family and recommend to our patients and members, so you can learn more and you can get a quote of what your monthly premiums will be. So you'll go down through that page that on that link that the QR code takes you to. You'll put in your age, you'll put in the number of people, either just yourself, you and a spouse, you and a family, and then they'll give you the exact monthly fees that you would pay to be a part of their plan. And if you'd like to talk through it personally, just reach out to me. Send me a DM, email me, contact me. However, I'm sure I'll post this on Facebook, and I'll post this to our members group. But if you have any questions, I'd be happy to walk you through that. So again, I just hate the insurance companies. It's kind of one of those things that were always a necessary evil because, again, if something bad happens, I mean, it could literally bankrupt you. So the health share plans are a great alternative, especially for those of you who there is no other choice. You can't afford the monthly premiums. You make too much to get the subsidies through the exchange, and it's a choice between going without insurance or any coverage at all, or paying too much and not being able to afford it. At least these healthcare companies are around, and they can be some sort of coverage so that you're covered if something bad happens. So, all right, I met my goal, less than 20 minutes. So, again, any questions at all, reach out to me. But to look into that health share plan, it's called Zion Health Share. Click on that or scan that QR code I have here on the screen, and I would encourage you to go to them, especially if you have specific questions about pre-existing conditions or other situations. I would just talk to one of their reps because I'm not a rep for the company. I don't know all the ins and outs, and I just know from my personal experience. And if you're an employer, you could save tons of money. Again, 15 employees, they're saving 6 figures. I have a company that I did a quote for 35 employees. They're going to save probably $300,000 in a year. Even trying to get the school district locally to explore this as part of their next contract, because I know with all those employees, I don't know how many employees the school district has here locally, but they could probably save probably at least $1 million, if not more. So, all right, that's all for today. Any questions? Reach out.